Now, this topic, of course, looks at anatomy and physiology, but with a view to health assessment and physical examination. So with the skeleton, you need to be aware that there are some bony landmarks that you need to remember. So the most prominent one is the spinous process. So if you feel down the back of your neck, there'll be one spinous process that is more prominent, and that is where the end of the cervical vertebra and the start of the thoracic vertebra are, or the C7-T1 intersection. Then as we move down, you've got the inferior points of the scapula, and they intersect at the level of T7 and T8 of the thoracic vertebrae. Then moving down again, when we're looking at the superior margin of the iliac crest, I've got a diagram to show you on the next slide, which crosses at L4. And then there are two symmetrical dimples overlying posteriorly over the superiliac crest spine at this, and that is the level of S2. Then of course you can also palpate the coccyx. So here we go. If we look at it again, I'll just read out those prominent spaces again. So the prominent spinous process, C7-T1, you should be able to palpate that at the back of the neck, the posterior view of the neck. The inferior points of the scapula are intersecting at the interspace between T7 and T8. So if you can see on the diagram, you have the lowest point of the scapula, and if you were to draw a line across the scapula, that would be at T7, T8 vertebral level. Then if we look at the margins of the iliac crest, that's the top rounded edges of the pelvis. If we drew a line across there, that would be in line with L4. And the two symmetrical dimples overlying the posterior superior iliac spine are at the level of S2. So you've got the two dimples inside the iliac crest. If we drew a line across there, we would be in line of S2. And of course, you can palpate when you're sitting the coccyx. You should also be able to palpate on the elbow the lateral and medial epicondyles of the humerus and the olecranon process of the ulna. At the wrist, you should be able to palpate the styloid process of the radius on the thumb side of the ulna. At the shoulder, you should be able to palpate the acromion process of the scapula. At the hip, you should be able to palpate the iliac crest and also the greater trochanter of the femur. On the knee, you should be able to palpate the patella, and the shin, the anterior crest of the tibia. The ankle will have the lateral and medial malleolus. The lateral malleolus will be the fibula, and the medial on the middle side will be the malleolus of the tibia. And of course, you will be able to palpate the heel or the calcaneus. The heel, of course, is one of the areas of the patient's body that is very prone to pressure area. So it's important that every 2 hours, at least, the pressure is relieved on a patient's heel if they're unable to move themselves. If they're unconscious, or if they have paralysis, if they are post-operatively and they have got a block that is stopping their muscles from moving, then it's up to the nursing staff to provide pressure area care for all bony prominences. The most common one where a pressure area will develop will be the heel. So it's up to you to provide comprehensive, high-quality nursing care to prevent your patient from getting a pressure area on their heel. So that was the last slide. That's the last slide of part 1. So I'll let you go back, have a look through your books, and remember that you should be able to label all the bones of the axial and the appendicular skeleton. You don't have to know all of the bones of the skull. You need to know that we have a skull and a mandible, but you don't need to know all of the other small bones of the skull.